Roger Federer is out of the U.S. Open. So he's announced that he is going to have surgery on his knee, and he's going to be out for several weeks on crutches, so likely missing quite a bit. He's had previous knee surgery. So let's talk about tennis players and the injuries that happen with their knees. Most of the things that happen for tennis players is they can get, but the injuries they can have is patellar tendonitis, which is an overuse injury. This is the patella, the kneecap. This is the patellar tendon. This is the quadriceps tendon attaching to the quadriceps muscle. But this tendon, because you're kind of moving your knee quite a bit, that tendon can get irritated and you get what's called patellar tendonitis. This is usually non-operative treatment, right? So physical therapy, rest, stretching, ice, things like that. But he's already said that he's had surgery. So I think more likely the surgeries he's had in the past, of course you can get all sorts of knee injuries, right? You can get ACLs, PCLs, blah, blah, blah. But most likely he's had some surgeries that he's continued to play. I think what most likely has happened, he's had injuries to his meniscus, right? So the meniscus, the menisci, plural, are it's this cartilage inside your knee that forms sort of a little lip around your knee, right? So a lip around the tibia that creates a little, increases the surface area for the femur to sit inside the tibia, makes it a little more stable, gives a little more stability to the knee, right? That cartilage, that meniscus, can fray over time, again because of overuse, and the edges of it can get frayed and be quite painful. So I'm sure some of you have had this, or you know somebody who's had meniscal surgery, where they go in and debride that arthroscopically. They just trim off the edges that are frayed, and that usually takes care of pain, and people continue playing for a while. However, the more you do that, you're taking away some of that support structure, and you're increasing stresses to parts of the knee. If you're a high-performance athlete, you're continuing to perform at a high level, you're continuing to put a lot of stress on those menisci, and they're going to fray further. He's had more injuries. Now, there's not much about exactly what's going on in his knee right now, but if I was to guess, because he's saying that he's going to have surgery, going to be on crutches for some time, is there's either three things that are happening. They're doing more partial meniscectomies, debriding some of that meniscus, or there's a tear in the meniscus that they have to repair, right? So if you get a tear in that meniscus, they don't heal that well because there's not great blood supply, especially to the inside part of the meniscus. So you do have to help them a bit. So you can suture them, put an anchor if they're detaching from the bone, and then just wait for them to heal. But you have to stay off them after you've had the repair on crutches, which he's mentioned, and then after they've healed enough, you can get back to rehab. Other possibility is, remember we talked about as you remove part of the meniscus, you increase the stresses inside the knee. So it could be that he has areas where cartilage has been damaged in his knee. He could be getting some cartilage type transfer, where they're putting chondrocytes, cartilage cells, back into the knee. It's a graft, in which case you have to stay off the knee again, which would explain why he might be on crutches. And after it's healed enough, you get back to rehabbing and see if you can play. See if you can get back to playing. He did mention that it's a possibility he may not play again. That could happen with a bad meniscus injury if it's bad enough, or if he has enough cartilage damage that it's too painful to play. He's been around for a long time. He's been amazing. Probably still going to continue to be. But I think he's either having some surgery to take care of his meniscus, or he may be having some issues with cartilage and be needing some cartilage transplants to fill in some gaps in the areas where the cartilage has been worn out. We'll see.